10 gym machines you should avoid after 40 years old. After 40 years old, our body begins to undergo significant changes. Joints are no longer as flexible as before, muscles tend to naturally lose mass, and recovery after workouts becomes slower. This doesn't mean we should stop training. The point is that we need to make more conscious choices, and some gym machines that you may have used for years, due to these changes, may now represent more risks than benefits. Therefore, today, you will see 10 machines that you should stop using, or at least replace, with less harmful variations that we will tell you about in this video, so that you can continue progressing without compromising your health. Stay attentive until the end because machine number 5 is the one that injures men over 40 years old the most. Machine number 10, leg extension. The leg extension is a machine that appears in almost 100% of quadriceps workouts. However, after 40 years old, it can be particularly problematic. The knee extension movement with load places enormous pressure on the patellofemoral joint, the one between the patella and femur. Over the years, the cartilage that protects this region naturally wears out, and using the leg extension can accelerate this process, increasing the risk of a condition called patellar chondromalacia and even osteoarthritis. Another problem with the leg extension is that it creates a shearing force in the knee, which means it pulls the tibia forward relative to the femur. This movement places excessive stress on the anterior cruciate ligament, which already tends to become more fragile with age. According to a study published in the Journal of Strength and Conditioning Research, the leg extension generates significantly greater shearing forces in the knee when compared to exercises like squats. Instead of the leg extension, opt for bodyweight squats or partial squats with light weight. These exercises strengthen the same muscles, but in a more functional way and with less stress on the joints. Lunges with body weight or light dumbbells can also be an option. These exercises better distribute the load between quadriceps, glutes, and hamstrings, creating a muscle balance that protects knee joints in the long term. Number 9. Seated abdominal machine. The seated abdominal machine, where you lean forward against resistance and then return to the starting position, is an efficient way to work the abdomen, but it also presents problems for those over 40. The main problem is related to the lumbar spine. This exercise forces repetitive flexion of the spine under load, which significantly increases pressure on the intervertebral discs, structures that already tend to wear out with age. The constant repetition of this movement can contribute to herniated discs or aggravation of existing problems. Additionally, many people compensate for the difficulty of the exercise by pulling the neck forward, which can cause tension in the cervical region and even headaches. Dr. Stuart McGill, a renowned researcher in spine biomechanics, frequently warns about the risks of these repetitive spine flexion movements, especially under load. A much safer and effective alternative for working the core after 40 are planks. This isometric exercise strengthens absolutely all the abdominal and lumbar muscles without putting the spine in compromising positions. You can also opt for exercises like the Swiss ball crunch, which provides support for the spine while you perform less extreme movements. Another excellent exercise is the bird dog, where on all fours you extend your right arm and left leg simultaneously, keeping the core stabilized, and then alternate. These exercises are not only safer, but also work the abdomen in a more functional way, preparing your body for everyday activities. Number 8. Pec Deck. The Pec Deck is widely used to work the pectoral muscles. The main problem with the Pec Deck is the position of the shoulder during the exercise. Even when executed correctly, when you open your arms in the machine, your shoulders are forced into a position of extreme horizontal abduction, often combined with external rotation. If executed incorrectly, which unfortunately is very common, the problems for the shoulder tend to amplify even more. This position places significant tension on the anterior shoulder capsule and ligaments, which tend to become less flexible with age. Additionally, the movement can compress the subacromial space, contributing to impingement syndrome, a common condition after 40 years old. The risk is even greater if you already have some muscle imbalance or history of shoulder problems. Another important point is that the Pec Deck is an isolated movement that doesn't reflect functional daily activities, making it less efficient for those seeking to improve quality of life beyond aesthetics. Instead of the Pec Deck, you can opt for push-ups, which can be adapted to your fitness level, against the wall, on a bench, or on the floor. Push-ups work not only the pectoral, but also the shoulder stabilizers, contributing to a healthier joint. Push-ups therefore not only reduce the risk of injuries, but also provide a more efficient stimulus for long-term muscle development. Number 7. Leg press. The leg press is a very popular machine in gyms, and at first glance, seems a safer alternative to barbell squats. After all, squats, perhaps along with the barbell bench press, are responsible for most injuries in gyms. However, this doesn't reduce the fact that, for people over 40 years old, the leg press can also present several risks that often go unnoticed. The main problem is related to the position of the lumbar spine during the exercise. When you lower the weight too low, the pelvis tends to tilt posteriorly, which flattens the natural curvature of the lower back, a phenomenon known as butt wink. This places enormous pressure on the intervertebral discs, which are already naturally more dehydrated and less elastic after 40 years old. Additionally, many people make the mistake of placing excessive loads on the leg press, precisely because the machine allows using much heavier weights than they could in a free squat. This overload can be harmful not only to the spine, but also to the knees, especially if you already have some joint wear. A study published in the European Journal of Applied Physiology demonstrated that, even with proper technique, the leg press generates significant compressive forces on the lumbar spine. A safer alternative is the kettlebell or dumbbell squat, holding the weights close to your chest. This type of squat allows for a more natural and controlled range of motion and involves more stabilizing muscles. The sumo deadlift is also an excellent option, as it works quadriceps, glutes, and hamstrings with less stress on the lumbar spine. For those with specific knee problems, step-ups on a low bench with body weight or light dumbbells is an alternative that allows you to easily adjust the range of motion according to your comfort. These exercises are not only safer, but also more functional, preparing your body for everyday movements. Number 6. Behind the neck pull-down. The behind the neck pull-down, or behind the neck lat pull, is an exercise that used to be very popular for working the back, especially the latissimus dorsi. However, it is no longer recommended today. When you pull the bar behind your head, your shoulders are forced into an extreme position of external rotation combined with abduction. This position places excessive tension on the anterior shoulder capsule and can compress important structures like the rotator cuff. With aging, the natural mobility of the shoulders tends to decrease, and forcing this range of motion can accelerate joint wear or even cause acute injuries. Additionally, to execute the movement, many people end up projecting their head forward, which places unnecessary stress on the cervical spine. This inadequate position of the head and neck can contribute to chronic pain and long-term postural problems. A much safer and equally effective alternative is the traditional front pull-down, bringing the bar towards the chest or collarbone. This movement allows you to work the same muscles, but in a more natural trajectory for the shoulder joint. You can also opt for dumbbell or machine rows, which are excellent for strengthening the back without placing the shoulders in compromising positions. For those who have access, the assisted pull-up with a band or assistance machine is also a great option, as long as it's executed with the correct technique. Before we continue to number 5, don't forget to subscribe to the channel. Having constant access to correct and science-based information is what will make you progress in the long term in the world of bodybuilding. Number 5. Any barbell bench press. The main drawback of the barbell bench press is the fixed trajectory imposed by the straight bar. Unlike dumbbells, which allow your arms to move in a natural arc, the bar forces your shoulders to follow a trajectory that may not be ideal for your individual anatomical structure. Over the years, small asymmetries that we all naturally have tend to become more pronounced, and the rigidity of the bar doesn't allow compensating for these differences. This can lead to disproportionate stress on one side of the body, potentially causing muscle imbalances or even injuries. Additionally, the barbell bench press places the shoulders in a position of internal rotation, which can compress the subacromial space and contribute to impingement syndrome, especially common after 40 years old. A much safer alternative is the dumbbell bench press, which allows each arm to move independently, respecting the natural mechanics of your body. Another excellent option is to use chest press machines that allow you to adjust the range of motion or work with cables at different heights, which provides constant tension throughout the entire movement. Number 4. Adductor and abductor machines. The hip adduction and abduction machines are frequently used by those looking to work the inner and outer thighs. The main problem is related to the non-functional nature of these exercises, Isolated adduction and abduction movements rarely occur in this way in everyday activities or in other exercises, which makes these machines inefficient for improving your general functionality. Additionally, the adductor and abductor chairs place the hip in positions that can be problematic, especially if you already have some joint wear. Forced abduction against resistance can excessively stress the hip joint, while adduction can cause discomfort in the pubic region. For people over 40 years old who often already show some degree of wear in the joints, these movements can accelerate the degenerative process or cause inflammation. Instead of these machines, opt for more functional exercises like sumo squats, which naturally work the adductors during the movement. To work the abductors, you can do standing or lying lateral leg raises, with or without resistance bands. Another excellent exercise is the clamshell, where you lie on your side with your knees bent and open and close your legs like a shell, keeping your feet together. Lateral walks with mini bands are also effective for working the abductors in a more functional way. Number 3. Seated calf raise. The main problem with this machine is the amount of load it places on the spine. When you sit down and place that weight on your knees, all that pressure is transferred to the lumbar spine, which already tends to suffer more wear with advancing age. Additionally, the seated position limits the range of motion in the ankle, reducing the effectiveness of the exercise for the calf muscles as a whole. Another important issue is that the machine forces you to perform the movement with bent knees, which mainly emphasizes the soleus, the deeper calf muscle, to the detriment of the gastrocnemius, the more superficial muscle. This imbalance in development can contribute to problems such as Achilles tendonitis. A much safer and effective alternative is standing heel raises. You can perform it using only body weight, holding light dumbbells, or even on a step to increase the range of motion. This exercise allows you to work both the gastrocnemius and soleus in a more balanced and functional way. For variety, you can alternate between doing the exercise with straight legs, emphasizing the gastrocnemius, and with slightly flexed knees, emphasizing the soleus. Another excellent alternative is modified jumping jacks, where you jump only with the tips of your toes, keeping your heels elevated. These exercises not only reduce the risk of injuries, but are also more efficient for developing functional strength in the calves, which is essential for activities such as walking, running, and climbing stairs. Number 2. Lumbar Hyperextension. The back machine, also known as the lumbar extension machine, or hyperextension, is frequently used to strengthen the erector spinae muscles. The main problem is in this hyperextension of the lumbar spine, which is forced during the exercise. This extreme position compresses the posterior articular facets of the spine and can aggravate conditions such as spinal stenosis, which becomes more common with age. Additionally, many people execute the movement abruptly or use momentum, which further increases the risk of injuries. The constant repetition of this hyperextension movement can, over time, contribute to the wear of the intervertebral discs and even to the development of spondylolisthesis, a condition where one vertebra slips over another. A study published in the Journal of Orthopedic and Sports Physical Therapy pointed out that repetitive lumbar extension exercises can exacerbate symptoms in people with certain types of lower back pain. A much safer alternative to strengthen the lumbar region is the modified Superman, where you lie on your stomach and slightly lift your arms and legs off the floor, is also an excellent option. For those seeking more intense work, the good old bent-over row with light dumbbells or barbell, keeping the spine in a neutral position, strengthens both the lower back and all the back muscles in a safer and more functional way. Number 1. Smith machine. The Smith machine, that structure with a bar that moves only vertically on fixed rails, is very common in gyms and frequently used for exercises such as squats and bench press. However, for people over 40 years old, it presents significant risks that often go unnoticed. The main problem is precisely in the fixed trajectory imposed by the machine. Unlike exercises with free weights, where your body naturally finds the most suitable trajectory for your individual anatomical proportions, the Smith forces your movements to follow a predetermined path. This rigidity can cause excessive stress on certain joints, especially if you have some asymmetry, and almost all of us do. For example, in the Smith squat, the fixed vertical trajectory of the bar can force your knees to move in an unnatural pattern for your structure, potentially causing stress on the meniscus or ligaments. Additionally, the Smith gives a false sense of security that often leads people to use excessive loads, further increasing the risk of injuries. Another important problem is that the Smith significantly reduces the work of the stabilizing muscles, which are fundamental for preventing injuries in everyday life, especially after 40 years old. A study published in the Journal of Strength and Conditioning Research demonstrated that the free squat activates the stabilizing muscles much more than the Smith squat. Instead of the Smith, opt for exercises with free weights, but start with lighter loads to develop proper technique. For squats, you can use kettlebells, dumbbells, or even a lighter bar. If balance is a concern, the goblet squat, where we hold a kettlebell or dumbbell close to the chest, is an excellent alternative. To work the chest without the Smith, the dumbbell bench press or cable crossovers allow for a more natural and safe trajectory. And if in addition to machines you should avoid, you also want to learn about 11 common mistakes that many people make in the gym that throw your workout in the trash, we have a video appearing right now on the screen showing and explaining each one better. Don't miss it. Thank you for watching this far, and may God bless you, my friend.